to everyone wherever you are in the world. Good morning, good evening, good afternoon. Thank you so much for joining our webinar today. We would love to hear where you are watching from, so please feel free to put whatever country that you're watching from in the chat. My name is Amy Carr. I'm the Vice President of Recruiting here at Worldwide HealthStaff Solutions. And today we are lucky to be joined by some visitors from Benedictine. We have a really great long-standing relationship with this employer, and we're so excited to learn more from them today. I would like to welcome Kathleen Murray, who's the Director of Workforce Solutions, Imelda Frias, who's the Director of Nursing from Garrison, North Dakota, and Genevieve Diaz, who's with Serenity Humboldt out of St. Paul, Minnesota. And we will turn it over to them to learn more about Benedictine, and then we're going to ask some questions. If you have questions for anyone in this group, please feel free to put them in the chat, and we will address them at the end. Thank you so much, and over to you, group from Benedictine.
All right. Thanks so much, Amy. So Amy has introduced us to all of you, but my name is Kathleen Murray. I am Director of Workforce Solutions. I've been with Benedictine for 7 years now, based out of our Twin Cities, Minneapolis, Minnesota location. And Imelda is our brand new promoted Director of Nursing at our Garrison, North Dakota facility. She started actually in February of 2020. And if you remember back to that date, that was 1 month before the COVID pandemic hit. So she had a very interesting experience when she joined Benedictine. And then Genevieve Diaz is the Assistant Director of Nursing at our Serenity Humboldt location, which is in St. Paul. And Genevieve has been with us for close to 5 years and really does help mentor a lot of our new international nurses that arrive at her community. So I'm really excited to share with you a little bit about Benedictine and the meaningful work you can find working in long-term care in the United States. So I want to tell a little bit about who we are. So Benedictine is a Catholic faith-based organization working in the senior care ministry, which was founded by the Benedictine Sisters of Duluth. So we were founded in 1985. We have more than 5,000 associates who work with us across our campuses, and we offer a variety of services. So our main one is skilled nursing, and that would be more commonly known to probably most of you on this webinar as nursing homes. We also offer memory care for those with dementia or other memory-related illnesses. We have rehab units, or what's called TCU, transitional care units. And those are for people who may be recovering from an accident or a surgery. They're not ready to go home yet, so we will do a little rehab on them and help them get set up so they can go back home and be independent. We also offer assisted living and independent living, and those are really for people who don't require a nursing home, but they might want the option to pick some services such as meals or having a nurse check on them or medication management. And then we also offer what's called Adult Day. And Adult Day provides activities and connections for those who may live at home, but they just want opportunities to get out and socialize and make connections, but they need those supervised activities. And then finally, we have a small portion of our communities that do offer home-based nursing services, as well as other community-based programs. So we have 33 locations that are in kind of the upper middle part of the United States. If you just kind of think of the whole United States, east and west coasts, we're kind of right smack in the middle, up by the Canadian border. 21 of our communities are in Minnesota, and 6 of our communities are in North Dakota. And then we have 3 other states that each have 2 communities, Wisconsin and Missouri, as well as Illinois. And in terms of our resident population, we have around 2,300 residents in our skilled nursing facilities, and then around 1,900 residents that are in our assisted living or independent living facilities. So we basically take care of around 4,300 residents amongst our 5,000 staff that work with us. All right. So, one of the things that I think really distinguishes Benedictine from other organizations is that with our faith based connection, our associates really are aware of the four core values that we base our organization on and what we truly try to live by. And our staff really do that in caring for our residents. Those core values are respect, justice, stewardship, and hospitality. And hospitality is really important for us, especially, of course, in terms of how we take care of our residents. But hospitality is also really important for us in how we welcome our staff. And I want to share with you a little bit about our history of international recruitment and welcoming those nurses. So we have been working with Worldwide Health since 2016 and have placed 125 RNs at our communities. We also have another 86 that we have recruited, and they are working their way through the immigration process. So it's not only RNs, but also RNs who will come to us as nurse aides and then take the NCLEX once they arrive in the United States. These are mainly candidates that do not have access to the NCLEX in the country. And then this is an option for them to be able to get here as a nurse aide and then take the NCLEX at some point once they arrive. So as you can see from our list here on the right, our nurses come from all over the world. We do have a significant chunk, though, of our population of international nurses that come from the Philippines. And so it is important for us to support you if you want to come join our team. All of our communities have international RNs, and they are often the ones who volunteer to help be the mentor for the new international RNs, which is really great because they know the experience that they would be going through and be able to come and help really acclimate them to not only the organization itself, but also the community and the United States. We provide 30 days of free housing for you and your family and can assist you in finding permanent housing. We also have a number of family members of our international nurses that work for us also at Benedictine. So they can work, some are also a nurse, or they'll come and work as a nurse aide. And we even have some of the staff children come work for us. So we have teenagers that might be working in our culinary department or want to get certified as a nurse aide and come work for us also. However, if you do have a spouse that works in another field, the community leadership there will certainly try and help connect you to the field that you are interested in working in. We also want your children to have an amazing experience when they come to the United States. So we do work with the families on knowing the good school districts, helping you with the registration process, helping you understand neighborhoods to live in so that you can have an easy walk or connection with the school. And then also our Benedictine communities, again, with 33 communities across 5 states, our locations are really varied from very small rural towns like Imelda is at, and also bigger, larger metropolitan areas like Genevieve is in St. Paul. So there are options to certainly fit your preferences. But I have to say, for the most part, we really do offer safe communities for people to work in and affordable cost of living. All right. So what's it like to work at Benedictine? So you're going to have a chance to ask Imelda or Genevieve those questions when we get to the Q&A portion. But I just want to share with you a little bit about that. So we offer pretty much in most of our communities 3 shift days, afternoons, and nights. They can be 8 to 12-hour shifts. And we do often offer shift differentials for those nights and weekends that are harder to fill. Overtime pay for those that work more than 40 hours. However, I do just want to note that with 33 communities, that can just vary at each location. We might have a location that doesn't need to pay a shift differential on weekends, and that may not be offered. It might be a location that may only offer 8-hour shifts and not 12 hours. So again, that can just vary community by community. Same with our staffing ratios. Those can also vary, but I would say kind of on average, it is a 1 to 14 RN to patient resident ratio with 2 nurse aides assisting. And that is very typical in long-term care in the United States. And mainly that is because if you might be used to working in a hospital setting where it's 1 to 4 or 1 to 6, you're dealing with a higher acuity level of patient. And with residents living in their nursing homes, that nurse to resident ratio is not that difficult, especially with the nurse aides that you have helping you. And then just touching on onboarding a little bit, we really do individualize the onboarding process to the RN. I mean, we do have kind of the checklist and things we walk through to help you. You're usually assigned a nurse that you shadow. And it can take anywhere from 2 to 4 weeks in terms of assessing competency with you as a nurse. But we've seen with our international nurses, it may take longer. It can take maybe 3 months or even more. But the goal is for you to be not only competent, but confident in your role so that you feel good going out on the floor and being able to work independently with your nurse aides. So we want you to really have that comfort level. So that's where the onboarding is kind of up to you to communicate with your nurse that you're shadowing with of, I would like a little more training on this, or I'd like a little more support. Can you walk through this again? I'm not understanding the electronic medical records. Can you show me more? So the more you kind of engage and get that support you need, then your onboarding process is going to be a really good experience. And then lastly, I just want to share a little bit about our benefits before we get to the Q&A. So we have a highly competitive and attractive benefits package. First of all, I highlight, we encourage our staff to continue your education. So we offer tuition assistance and education assistance, as well as loan repayment programs. We have full packages for medical, dental, vision insurance for you and your family. And your vacation days begin to accrue immediately. We have generous, what's called PTO, paid time off packages in terms of your vacation days. We also have retirement plans and what's called a flex spending account. A flex spending account is for you to have childcare and medical expenses kind of taken care of pre-tax. So you save money if you can set those up through us in what's called these flex accounts. We also have life insurance and disability, and then what's called employee assistance, EAP programs. And that is just a whole array catalog of services that are open to our staff that offers things from as far wide as mental health counseling to financial planning if you need it. So, so it's great. It's a great service. And in addition to that, Benedictine Associates started an Associate Emergency Assistance Fund. And that was started back in 2007 and is funded by donors. And many of those donors are our own associates, like myself, who help contribute to that fund. So we want to be there to assist our staff if they have an emergency. So if we have an international RN whose family member might be sick back in the Philippines or in Kenya, and they need an emergency plane ticket to get home and can't afford it, they can apply to the fund to help get those costs covered so they're able to get home to be with their loved one. So overall, I'm just really proud of the work that we do to meet the needs of our staff, and especially to meet the needs of our international staff that come to work at Benedictine. So that's just a little picture of who Benedictine is. And I want to turn it back over to Amy to, I think, do a little Q&A with our RNs.
Yes, great. Thank you so much. It sounds like what a great place to work. It's a mission-driven place that's got amazing opportunities and benefits. One thing I just want to mention before we go into this Q&A, I've seen a couple of questions about requirements. The requirements for these positions are that the candidates are currently working in a bedside position and that they're an RM and have passed the NCLEX. So those are the requirements. And Benedictine is today hiring RN positions. So that's what they're currently hiring for. Okay, thank you so much for sharing that information. I think we'd love to hear from Imelda and Genevieve about just some questions about their journey, and maybe maybe really if you could both just tell us just quickly about your journey to get to Benedictine. We were talking about it a little bit before this call, and I think they're both really great. So maybe we start with Genevieve. Would you just tell us about how you got to Benedictine, and like what your country journey was, and what your jobs were?
Okay, so I started as a nurse in a university hospital back in Manila, and I worked there for 20 years. I became initially a medical surgical nurse, and then I became an ICU, I mean cardiovascular unit nurse, and then I became a supervisor before I left the country for Canada initially. I had an application as a nurse over here in the US. So I was already an NCLEX passer, but then I couldn't find a job. It was a retrogression. So I opted to go to Canada. And then I was looking for a job here in the US. I couldn't find one until the time I come across Worldwide Health in Facebook. And luckily, they connected me with Benedictine. And it's funny because my school back home is also Benedictine, like from elementary until high school. So I think it was faith that I met Benedictine through Worldwide, and then they hired me, and I started working here since July of 2019.
It was meant to be.
Yeah.
Yes, it's meant to be. I started as a TCU nurse. I started as a TCU nurse. I became a long-term nurse manager after like a year and a half. And then I'm a TCU nurse manager right now and an AD1.
Awesome. Imelda, how about you? Will you tell us about your journey?
Sure. Yeah. So I started my US application back in 2012. And it was really the retrogression before is really long, so they should take advantage now because uh, most of the time the long wait for having the visa will be not as much how we waited before. So then the retrogression, then I worked for 2 years at the hospital setting in the Philippines. And then I decided to go overseas. So I worked in Qatar starting 2012. I worked there for 7 years. I was on outpatient clinic. And so 2019, when the retrogression finally opened up. So I started applying. I had an agency before. It was not the Worldwide. So they contacted me, but then they wanted me to go back to bedside setting, which I cannot, because I have family back home. So and then Worldwide found me. They sent me an email. They booked me for an interview right away, but I was opting for a hospital base. But then that really didn't push through because they wanted me to have the current bedside. So again, the Worldwide found me another employer, which is the Benedictine. And so that was when I had like 2 years of waiting for to finally get into the US. And that was the start of the pandemic. It was crazy. Well, here it's not yet the COVID not yet hitting the North Dakota back then. But then after a month that I came, then we started, the process or the pandemic then. So that's how I got here.
Awesome. Thank you. And I think one of the really great things about both of those stories is it wasn't fast. Like, this is not a fast journey to the US. So there was a lot of steps. Mm-hmm. But I think one of the things that you can hear from both of these nurses is that they stuck with it. And then in the end, they found a really great home that they're happy in. So tell us about what do you love about working for Benedictine? Maybe let's start with Imelda. What do you love about it?
Oh, I love that it's faith-based because I'm Catholic and I'm a devotee. Like Genevieve, she said that it's by faith. So I was always praying with the Saint Scholastica, and I learned that Saint Scholastica is the cousin of Benedictine. So people here are very accommodating, and they're very friendly. I feel home working in Benedictine. So
Great. And Genevieve, how about you?
So one, I love the people that I work with. Initially, when I came, I have the fear of, although I came from Canada, it's very diverse. But then when I came in the U.S., it's kind of different because I work as an outpatient, and then now I'm working with patients and with patient like close contact with residents and patient, and then my coworkers. So I really love the people here. My coworkers are wonderful. I felt so welcome. I never had difficulties adjusting when I came. The schedules are good because we are 8 hours here in Humboldt, so we have like 3 shifts. And I work initially as a second shift, and I love the afternoon schedule. The third one is I love the patients here in TCU because I'm a TCU nurse manager. You know, you come and go, they come and go. You see them not well when they come in, and then you see them well when they discharge. Another thing is the opportunity that I had here, like from a TCU nurse, I became a nurse manager, and you know the schedule that I have right now is actually really good. I only work like morning shift, and you will all have those opportunities if you really work hard for it, and then weekends off and holidays off. The other one is salary is competitive. I feel that that's what I have it here from the time that I started until now.
It's great. And Benedictine is a company that has a lot of different locations. I Kathleen showed that slide, and there's a lot of opportunities like throughout the company. I think for any job, probably anywhere in the world, but definitely in the U.S., it's important to come and do a good job and work out your commitment. But this is also a company where there's a lot of room for growth. And for anyone who has gone on this journey and taken the NCLEX and worked in several different countries to get to the U.S., there's probably a lot of talent and leadership skills and all these things that Benedictine would love to have in their organization long term. Kathleen, how about you? What do you love about working at Benedictine?
Well, I think like Genevieve said, the coworkers here, I truly love the work team that I have to work with, especially those who assist us with welcoming the international nurses who come. And as Imelda said, the faith-based part of the organization really does matter. I mean, we're a very mission-driven organization. This is not about money. This is about how do we care for people, the elderly at end of life, give them dignity, give them fun, give them connection. So many of our staff describe our residents as family. They say it feels like family to them. And that is just so common. And again, for us, it's, both Imelda and Genevieve are perfect examples of working their way up. They came as an RN, became a clinical manager, became the assistant director of nursing. Imelda, I know that executive director there has been wanting her to be the DON for quite some time and has been trying to convince her to take it on. And she finally just got that promotion. So there's definitely opportunities to grow within our organization. It can be, as somebody said, it can be cold where we are, but we have warm hearts here in our locations. And you really see that in our residents and in our staff.
Great, thank you. And just a reminder, if you have questions and you have joined us today, please feel free to put them in the chat and we will take them on in just a little bit. Okay, so you mentioned locations. Some of them are in cold weather locations. I think maybe Genevieve and Imelda, can you talk a little bit about, so there's lots of different locations with Benedictine. Genevieve and Imelda are in 2 of the many. And so, I think there's also a question about how our location's assigned, which we can talk about in just a minute. But can you talk about your location and like what you learned when you moved there? How safe do you feel? What's around you? That sort of thing. And maybe Genevieve, can we start with you?
So when I came here, I came from Canada, so I know the weather already, but from my experience, because we all came from, like, the Philippines is a tropical country, you really just have to invest on your coat and then your shoes for winter. But I really love the four seasons. From the time that I came to Canada, it's almost the same weather that I have here. The best time to come, if like coming from a tropical country, is like spring, so you can adjust, the body will adjust to the climate. Like spring is not too cold, and then you go to summer, and then winter comes, your body's already adjusted. But the very first thing I invested is for the coats and the shoes, the proper footwear that you wear for winter. Since I live in our location, Humboldt is actually near downtown, so my apartment is in Lower Town. I'm not scared over here. When I started, I was using Uber to go home, and I worked the evening shift, and sometimes I would go home 1 o'clock, 12 midnight. I never was afraid of going home by myself. So this place, I think, well, before I came, actually, I read about St. Paul, and it's one of the safest state here in the U.S. So I was kind of thankful that I was able to come over here, and all your the necessities are just really near at where I live right now. So I didn't have a hard time adjusting. I feel that whatever we want to do, we can afford to do it. Whatever we need, like necessities wise, or even sometimes something luxurious for yourself to award yourself, we can afford it. So those little things, but life is simple. As long as you work well, then you can always be rewarded with it.
That's a great point. Imelda, how about you? Can you talk a little bit about your location?
Yeah, sure. Mine is very different. I in Garrison, it's a very small community. It's actually far from cities. Like you have to travel 45 minutes to get into Target and Walmart. But then we have a small store here that has a lot, like a convenience store. So I came from Middle East, which is really hot, scorching, as we say. So when I came here, it was February. It's to starting spring or close to spring. My very first experience of a snow, it was really fun because back home we don't have, and it's my first time. And like Genevieve says, like you have to invest on your coats, but I was lucky because my colleagues, I have two Filipino colleagues here that when I came, they're very accommodating. One of them really, she lent me, or she gave me some coats, and she said, yeah, you don't have to bring many. You can just buy in here. Life here is simple. I think it depends on each preference. Some wanted to be on the countryside, some wanted to live in the city. Um, the um, how do I say it? The schools are close to our house. Like after 2 years of being here, we were able to buy our own house. And my workplace is just like 3 minutes away from our house. We also have hospital here, and the church are close by. Um, just the um, far from the city. That's the only downside. But then I don't mind because I feel safe here. You can just leave without your house is not locked, or you forgot to lock it. You wouldn't worry that things will gonna be missing. Kids can play outside without you watching them. Like, I think the neighborhood are very safe and friendly, like, because we're in small community. The neighbors are watching your kids for you. Also, North Dakotans, I think they're known to be friendly. Like, everybody doesn't know you, they're waving at you. I was like, I don't think I know those people, but that's how they are. They're like gonna wave at you. When I came here, I don't have a car, so I used to walk going to buy my necessities, and people were stop and ask me for a ride. I was like, I'm worried. I was like, is that if their intentions are good? But then I've learned from my friend, yeah, they are like that. They're very friendly, and so when I started here, I don't have a car. My colleagues used to drop me and pick me up going to work. So yeah, that's how my transition was smooth when I came in here.
Okay, great. And I think, really good example of maybe some places that some of the people watching haven't thought about moving before, but really good to research and think about locations that you've maybe not thought about before. The U.S. is so big. First, every state is a little bit different. And even the cities within a state are not the same. So every state is not the same. And so I think learning about different places that might have really good cost of living and might be really safe and have really great communities are probably not the ones that you may have heard the most about. And it really, really good to take some time to research and think about that, because it might be a great place. It might be a great first place in the U.S. for you. And then, Kathleen, there's been a couple of questions about locations and jobs and transferring. I know you showed us a map and talked about locations, but would you talk a little bit about, in the interview, how you talk about locations, and how Benedictine assigns locations to nurses, and what if, once they've arrived, are there options to transfer?
Yeah. Okay. Good questions. So, we kind of do around different cycles. So we had a 2019, a 2021 cycle, and now a 2024 cycle. So we go and we ask all of our communities, looking 2 to 3 years out, how many international nurses would you like us to recruit for you? And then we get kind of a master list amongst our 33 sites. So right now we're in a cycle of recruiting 67 nurses right now. We're in the midst of interviewing. So if you're interested, you could move quickly. And so so some community asks for 6, another community asks for 2. So we look, and in the interview, we really do ask, have you researched the 5 states? Do you have a preference for which one? Do you like rural, small towns, or do you want a more urban big city? Because we do want to take in those preferences. If you have a spouse, and what kind of job is he looking for? So we can think, well, maybe in the smaller town, he might not be able to get a job there. We might want to look at a bigger city. How many kids? Okay, what school districts might make sense? We really do try to match not just your experience, but your overall preferences and family situation to the right community, so that it is the right fit for all of you. And we really do work with you on that. And we have a lot in the interviews that say, oh, it doesn't matter. You can put me anywhere. And I always say, no, tell me what you like. Feel free to let me know that information so we can make it the best placement for you.
I think that's great. And I think having a little bit of trust in Kathleen and her team, and I think maybe also the worldwide recruiters, if you tell us a little bit about what you're looking for, we can help you narrow down the location, sometimes better than the internet. Sometimes we can do a better job because we might have the working knowledge of the locations.
Yeah. In terms of transferring within Benedictine, that is an option. I think it may have happened maybe 1 or 2 times where it was, I think the husband got a job somewhere else. And so we had a location that they could move to for the nurse to then continue. on contract with us. It doesn't happen very often because usually people like ending up where they're placed and they don't want to move. But it's certainly, again, with 33 sites in 5 states, if somebody did want to look at that in terms of family circumstances or moving, we can explore that.
Okay, great. Thank you. One thing that I see, and you also talked about this, Kathleen, but I just want to revisit it. One thing I see a lot of chatter about for skilled nursing facilities is the patient ratio. And, so especially if someone's coming from a different sort of nursing position and then coming into long-term care or skilled nursing, there is some concern. And, I think especially during COVID, and there are some, not every employer is Benedictine, I'll say that. And so I think there's concern out there from nurses about safety. But I think also maybe like if we could talk a little bit about like CNAs and how they help support RN work, because I think that's really important. So Imelda and Genevieve, can you talk to us about like a day in the life of like a long-term care nurse and how CNAs help support what an RN does in this area? Maybe Genevieve, why don't you start us off?
Yeah, so in a floor, the nurse is the team leader. So she will be the one or he will be the one to take care of how the patients are being divided, how so they're the ones who give these assignments to the patient, to the CNAs, I mean. Usually here in Humboldt, or I think Benedictine wide, we do have patients assignment already set for how many CNAs on the floor. And then as an RN, that will be, so the RN will play as a team leader, and then they actually we work together very closely with the CNAs over here. So, or any other facilities probably. In the morning or the start of the shift, we receive reports from the previous shift, and then the RN will talk we'll discuss it with the CNAs on how they will work together on their shift. So the CNAs also on each floor would give reports to the CNAs, the incoming CNAs, and then that's the time they will work together. They have their own patient's assignment. They have their own work care cards to work with, and if they have any questions, the RN is the team leader, and they all work as a team.
Okay, great. Imelda, what would you add to that?
So yeah, that's how it goes with my facility too. Like there is on the day we have like 2 nurses. Our patient ratio was if we are full house, our bed capacity is 52 to 54. So then that will be divided into nurses, and we have like sometimes 4 or 5 CNAs on the floor during the day, and we already have this assignment to our CNA, how many people they're gonna handle, and as Genevieve says, the RNs will be the charge nurse, and they will be the one. You should know how to delegate. Like CNA will be you'll be working closely with your CNA. They'll report you about whatever happening, like skin issues or vital signs that is not normal. So yeah, like basically the main thing you should know is how to delegate and how to handle your stuff. Like if you will be challenged for that day, sometimes people get sick, they don't come in. So yeah, you should be ready for whatever comes for the day. That's usually our day goes.
Yeah, so I think the important thing is it's not like one nurse out there alone. It's a team of care folks where the nurse is the charge nurse and directs other people to help support. And so I think for those people who haven't had exposure, I think it can sound really scary, but really it's a team with the nurse directing the different folks to help support care. Kathleen, would you add anything to that?
Yeah, no, I really do think kind of the perception with long-term care in terms of the ratios, our residents aren't a high level of acuity. So the ratios are higher because the care needs aren't as high. And so when you have that nurse who can manage with those two nurse aides, they're going to be able to take care of it because they also have the culinary staff helping with the food. They also have the therapy staff helping with therapy. You have the activity staff doing wellness activities and the bingo and the other games that they play with them. So it's not just like, oh, that nurse and two aides. There's just also a whole team and support system and departments that are also working to support and help take care of the residents. You know, our housekeepers can know as much about our residents as any nurse because they're in there all the time and they're talking with them, and they might come in and say, oh, Genevieve, I've noticed his coloring's a little different because our housekeeping staff cares about our residents and they're in there all the time. So it is really a big team effort taking care of the residents at our facilities.
Okay, great. Thank you. So I'm going to take a couple of questions, I think, from the group that have come in from the folks that have joined us today from around the world. And then once we answer those questions, I think we'll come back to the Benedictine team for final thoughts. Okay, so a couple of questions. I think maybe the most important one is, how can I apply? If you want to work at Benedictine, please apply. The link is at the top of the chat. You can go to our website and apply and tell your recruiter that you are really interested in interviewing with Benedictine, and we have interviews that are going on right now. So we'd be happy to schedule you for an interview if you qualify. Love to help you get connected. If you are already working at Benedictine and you have a job there and you would like to refer your friends or family, we have a really great referral program where you can earn $250 when your friend, family, or colleague's petition is submitted. So please click on the refer friend link and refer your friends and tell them to ask about the Benedictine interviews, and we would love to get them connected. And then maybe a question for the Benedictine group. How do I pick up a shift or do overtime if you have 8-hour shifts? Do you work 16 straight hours, or can you only pick up on your off day?
Do you want me to answer first, Imelda?
Sure.
Yeah, sure.
Yeah,
You go.
so if you're working like the morning shift, and you can pick up another shift, and that will be 16 hours. So most of the people will pick up a shift like in the morning 6:30 till 3. They will pick up the 3 p.m. to till 11. Or if somebody's working on the evening shift, like 2:30 till 11, and then they pick up the night shift. It's always like a 16-hour. And then you also get some bonuses on that. In our facility, we have a bonus per hour on weekends. It's different than the weekdays. And you can also pick up shifts on your day off if you want.
As many as you want.
Yes.
Yes.
As many as you want. You can pick up a shift on your day off. And also, like for example, like we are short for this day, we ask our staff if they want to work on this day. I think in a day they can work for 16 hours only. That's per state or per law. They cannot work more than that. But then, yeah, you can pick up as many hours. In our facility, we have the pickup shift will be plus 30. And we have also night differential. So it depends on how much you can work. But yes, you can pick up shift. There will be in my facility, they'll offer you if there is opening position on that day. CNAs also they have a lot of pickup shift too, also the RN. So that's how it goes.
Okay, great, thank you. A couple of questions have come in again about what are the qualifications to interview. And this is an RN position, so Benedictine is hiring nurses right now that have already passed the NCLEX and are currently working as a nurse. So those are the requirements. And then I see a couple of folks who are asking specific questions about their experience. We would love to answer those questions for you, but the best person to answer that question is your recruiter. They are happy to look at your resume specifically and go through your experience and help see if you are a good candidate for an interview. So if you haven't already applied, please go ahead and apply and get connected to a recruiter, and they are happy to review with you your individual qualifications and help you register for an interview. I think those are all of the big questions. So maybe let's go to the team for just some final thoughts and what would you want any nurses to know that are considering Benedictine as an employer? And let's start with Imelda.
Benedictine will offer you lots of opportunity like they did to me. So I started as an RN. I worked there for 4 years now, and I loved it. Now they offered me a position to be at the DON. So there will be lots of opportunity also for your spouse or whatever. So my husband works also in Benedictine. He started in environmental services. Then he moved to culinary. Now he is a CNA. So hopefully he will be able to move forward as an LPN. Take advantage now because the waiting time is shorter than what we did back then. And I'm sure you will love working with Benedictine. They're the values, the core values that we have. On my place, my boss is really he's really nice to us, and that's awesome. It.
Thank you, Imelda. Genevieve?
So one is, of course, the opportunity that they gave us, like coming over here in this country and making us successful nurses. That's one big thing. That's why we love working with Benedictine. The opportunities that were open for us, like when we started as a nurse, we were guided well. And then coming from another country, like in Benedictine, we usually have Filipinos in each facility. So like either you're not Filipino or not, whatever, we are very diverse. So we can always guide you in whatever when you're starting to work over here and coming to a new country without anybody to help you. So we are all, including our administrators, very supportive, our HR, our DON, and of course, like if you're Filipino, we have a lot of Filipino nurses and we always support you. I think that's it. Like having all this opportunity, I feel blessed. I'm grateful. That's why I'm still here. I'm still here with Benedictine.
That's great. And I think Kathleen showed a lovely graphic that has there is a lot of diversity. There are definitely nurses from the Philippines, but also lots of other countries. And
yes.
And I think increasingly a large number of candidates that are going to start arriving in the next couple of years from countries all over Africa. So like really exciting, diverse things that are happening in the Benedictine International nurse and nurse aid space. Kathleen, how about final thoughts from you? What you would want nurses to know?
Yeah, I would say from a organization-wide perspective, Benedictine knows international recruiting is going to be a key component for us to staff our nursing facilities. We are not meeting the challenges with workforce in the United States. So for us to invest in it, to invest in the nurses who come here, invest in the nurse aides that are also coming here, it matters to us. So we will be, even more than we have been focusing on international recruitment. I just went to Nairobi, Kenya in January. I was able to interview about 12 nurses in person, which was lovely. and be able to tour some of the colleges in Nairobi that they're training at. So we will be doing more and more to help recruit, bring them here, onboard them well, provide them the support they need. And we're excited. We love our international RNs. They are really saving us in some of our smaller rural communities where they are the main nurses taking care of our residents. I don't know what we do if we didn't have some of our nurses like Imelda in Garrison, North Dakota. But even in our cities, locations where you can have high turnovers sometimes in today's workforce, our international nurses are really strong, great work ethic, respect for the elderly. So they're just great, ideal candidates for us that we would love to have come join our team.
So, well, thank you. Thank you to the Benedictine team for your time this morning. It was so great to hear from you. Thanks to everyone who joined us to hear about an amazing employer in Benedictine, great opportunity for career development, long-term employment in the U.S., lots of really great places to live that you may not have thought about, but that you should. So please make sure to reach out to your recruiter. We would love to help schedule an interview for you. And thanks to everyone. Have a good evening or afternoon or morning and day to come, wherever you may be.
And did you have a slide, Amy, on the refer a friend? I think that was one of your last slides.
We do have a slide, and it's also in the above the chat. So you can refer a friend. Please make sure to you can earn $250 every time your friend's petition gets submitted. So this is a great way to save money to come to the U.S. if you are on the journey yourself, or even if you're here. Yep, absolutely. So thank you, everyone. Please refer your friends. Also, don't forget to like us on Facebook. And I hope everyone has a great rest of your day.
Thanks, Amy.
Thank you.
Thank